Now there's a fear that the number of Medicaid enrollees can bring the Affordable Care Act right to its knees. Matt Markham spoke with an expert today who says if this trend continues, it could offer very few savings for insurance exchange shoppers. Matt?
Hi, Liz. There has always been some concern, from the critics at least, that the Affordable Care Act might not end up being affordable for all people. The federal government expanded access to health care for low-income people who qualify for Medicaid. And in New York, more people signing into the exchanges are signing up for the no-cost option.
If the trend continues, it could challenge the integrity of the Affordable Care Act.
It's been challenged already, the subject of political bickering for months and then glitches on state and federal exchange websites when they opened. But the numbers now prescribe a whole new concern about the health of the insurance program. In New York State, about 37,000 people have enrolled. Over 13,000 are covered under qualified health plans they have selected on the exchanges. But nearly two-thirds of enrollments are to Medicaid at no cost to those enrolling.
Unless the bodies are there to support the system, that are healthy and that are paying, the system cannot stand under at least the strength of its own estimates.
Gerald Silberstien served for many years as a research analyst for the New York State Health Department. He's now an assistant professor at the Sage College's School of Management.
If this continues, I would expect that insurers would be looking for permission from their state agencies to raise rates next year.
There may not be enough people enrolled to keep the pool price low. If not enough well and relatively young people are enrolled to insurance on the marketplace, Silberstien says they can't subsidize costs.
This would not happen if enrollments were primarily to Medicaid, because there's no new premium money coming into the system.
Silberstien might have expected lower numbers of Medicaid enrollees, but says it shows strong interest initially in the program.
You'd expect that people would do the application and then do their shopping for different types of policies, and that they might take some time before settling on a policy.
So in other words, people with more options will be taking more time to select a specific plan. Now, I did speak with a representative from the State Health Department by phone late this afternoon, and he told me that the overall picture of enrollment isn't that grim. 174,000 people have completed the application process, and I'm told 90% of those applications are for qualified health plans that you would need to pay into. Liz?
What can you tell us about other states, Matt, and ones around us maybe then? Are they seeing the same kind of a level of enrollment?
Well, Massachusetts, number one, never got back to me, but Vermont did. Of course, it's a smaller state, so the numbers are a little bit different. 987 people there have selected private health plans. 601 have chosen the Medicaid or the Child Health Improvement Program. That's noticeably less than New York when you consider the fractions of the whole enrolling in Medicaid, but it's still a pretty significant number.
Yeah, it is interesting, and maybe we can stay on top of those numbers as time goes on, just to see whether it sort of burgeons or not.
Right, and whether or not it actually is something that's happening right off the get-go, or people really are taking their time to select a plan that they would have to pay in for and then subsidize everybody else in doing so.
Great point. Matt Markham, thanks.